maintaining coverage here is absolutely critical. I like to think about sort of the things that are at risk, and it's those patterns that we've put in place, all those drivers that contribute to success in population health management, right? So it's good preventative care, it's chronic disease management, it's access to emergency services. Really, I think the last thing that anybody wants is for a patient to show up for emergency services or show up for their preventative care visit or to an appointment where they're coming in to manage their diabetes and hypertension, and to find out at that point that they don't have coverage. If you step back from that, there's really two sides to this equation, right? The reality is that through this unwind process, some people might not continue to qualify for Medicaid, because their situation has changed. It's always better to understand that up front and be able to redirect them towards other resources where they can get coverage so that they can maintain that continuity of care to make sure we're doing the right foundational things for pop health. The ACA exchange is a great example, right? Where depending on the state, and I know we've got people from many different states in the audience today, there's going to be lots of folks who don't directly qualify for Medicaid who are going to have free or heavily subsidized options available through the exchange. Now, those are the folks that don't qualify, but on the other side of the equation really is this idea of churn, or people who are legitimately still eligible for Medicare, who lose their coverage because of this bureaucracy of enrollment verification or lack of awareness or social factors that are barriers. And by some estimates, I've seen predictions that 7 million people could fall into that category. And what we know is that most people who lose Medicaid coverage often go without insurance for a period of time before hopefully they can get re-enrolled. And that's particularly risky for folks with chronic conditions or other complicating factors.